Hi, Dr. Shakira. Welcome to my YouTube channel.
It's a pleasure to be here, Julia. It's awesome to check in the new year.
So, we would like to know about your work, Dr. Shakira.
hmm it's so funny to ask that question as soon as we get back from holiday because I feel like this week, Julia, I was supposed to start work, but I feel like, Monday will be the day it really starts. Very broadly, in terms of my bread and butter and the work that I do, it's in public health. And within
Okay.
public health, I focus a lot on policy and research.
Okay.
Outside of public health and growing up in South Africa, our country is so marked by racism. I work with a foundation known as the Ahmed Kathrada Foundation. And Ahmed Kathrada spent 26 years on Robben Island alongside Nelson Mandela. And I
Yeah.
fight for non-racism in the country. And
Okay.
aside from all of that, I've also joined Operation Smile South Africa as the ambassador to help, especially children and young women and girls, to correct their cleft palate or their cleft lip. So I'll pause there because there's so much more, but I think in a nutshell, that's some of the main work that I do.
So, during your years of work, what are your some of the most memorable experiences you had working with? Let's talk about especially working with a girl child.
hmm I think there's so many different experiences I could talk to, even in the healthcare system. There were many moments that, the penny dropped and there were things I wanted to do and there were projects I worked on which were really exciting. One of my first entry points into working with a girl child was when I finished my PhD and I landed my first job at what was known as the SRHR Africa Trust, or SAT. And this was a regional non-governmental organization. And I got to run youth leadership programs across the African continent. But I was also involved in programming for young girls. And one of my very first introductions to this was a conference on child marriage in Mozambique.
Okay.
And I really had training in health systems, not so much in gender issues. I knew the basics, but not really what was the reality on the ground. And at this conference, Julia, I got to meet girls that were as young as 10 years old, all the way to 16 years old, who were child brides.
Oh,
And I remember the young woman who was 10 years old and telling us the story of how she was forced into a child marriage when she was offered an education. Her husband beat her up. When she
yeah.
tried to leave her husband, her family wouldn't accept her.
Yeah.
When she finally left her husband, she got to a healthcare facility. And at this healthcare facility, nobody would help her because she didn't have documents until an aid worker found her. This little girl was also pregnant at about 10 or 12 years old.
Oh my God.
And just listening to that story, it was one of the first stories I heard working in sexual and reproductive health and gender equality. And that's the story that really stuck with me.
Okay.
And I think let me pause there, Julia, and then I'm sure you've got other, questions. Otherwise, I'll
No,
go on telling you. Yeah.
I think this is one of the most critical issues in any girl child we are facing around the world. Our country is definitely not, we're going through the same thing with certain castes and certain strata of people. So I think your work is very important, I understand that. So what are your strengths here? You worked in this area, what are your strengths? Do you want to talk about that?
Mhm. I think my biggest strength or my greatest strength is that I do everything with love and passion. And one of the reasons you also struggle to pin me down is because when I commit to something, I have to have the heart for it. I don't like to do things when I'm tired. I like to do it with all of my heart and soul. And I think passion is very important in the work that we do because sometimes we follow money, sometimes we follow careers, sometimes we follow prestige, but we forget about that 10-year-old girl who was a victim or a survivor, rather a
Yeah.
survivor of child
Survivor.
marriage.
Yeah.
Or we forget about the woman who's been raped. That's why we do the work that we do. And I think that's one of my greatest strengths. It's the ability to connect with people, to listen to them, and their deep drive and passion to want to change the situation.
True, very true. So, what's your goal in life? Where do you want to reach in another 5 years? What is the work which is very close to your heart and you want to finish and achieve that?
When I started out, I remember it was my birthday in what we call grade 4 in South Africa. And my dream at that point was to be the president of South Africa.
Oh,
And I
wow.
went through school, I went through university. I studied a bit of medicine, but I knew that medicine is not the path that I want to follow. I still wanted to be the president. And so I entered into public health because I wanted to be the Minister of Health. And that was my plan. I figured it all out, and I hoped that would be the plan. I then got into the space. I worked in the research field. I loved research. I absolutely loved research. But I also worked with people who did not want to see me succeed.
Right.
And at that point, I was suffering from mental health issues, and I decided to leave the research environment. I got into the advocacy space, and I worked with women and girls and running youth programs, which I was talking about. And then I got headhunted for a massive job, and I thought this was my dream job. And I took it, and actually it didn't work out. And so, long story short, I've even been in the African Union, and it's not the place for me. And I think the reason I'm telling you this is that I started off my life saying that I want to be the president and I want to be the Minister of Health. And over these past 10, 15 years, I've started to discover myself a lot. And as I discover myself, I never thought I would be an entrepreneur. I've just launched my consultancy firm. And the reason I've done that is because I'm not sure I want to be in a political position. But what I am sure about is that I want to build young talent. I want to change communities, and I really want to bring change. And one of my biggest dreams, Julia, is the reason I entered the healthcare sector is because I know the struggles of being in the public healthcare system. Yes. And I want to fix that one day. And so for me now, it's not anymore about being the president or being the minister, but it's how do I solve public health issues in the world.
Yeah, I think it is fantastic, and I wish you luck with it. So any challenges which stands out, a severe challenge you faced in your life which has stayed with you and which has made you more stronger?
I think we all have challenges. I mean, we really meet people who say we don't have challenges, in our own spaces. And so one of my biggest hurdles was growing up. I was in a very disadvantaged family. And, when we started to talk about child marriage, and I never had that consciousness until I heard that 10-year-old girl talk about her marriage. Obviously, I'm of Indian descent, and so if I think of both my maternal and my paternal grandmother, they were child brides, and what was their life expectancy and their life chances and their education. And now that I think of it, my life is substantially different. So I was lucky to be educated, but at the same time, I grew up in a very disadvantaged home, and so education was out of my reach. I got to university, and I always joke and I said I had not a cent in my pocket. But in the end, with a lot of sponsorships and a lot of hard work and a lot of help, completed my PhD. I talked about the workplace. For example, I loved working in research, but unfortunately, I was in a very toxic work environment, and I decided for my mental health, it's better to leave. Yeah. Then, like I said, I entered the African Union. I was appointed. It was historic. It was 2 years ago. I was very excited with the will and the willpower to want to change this continent. And I got into an organization that is highly bureaucratic, one that either you're a puppet and you conform, one where you're not able to bring change. And I'm a doer. I don't like to be in an organization where I'm just window dressing. Right. And so there's been multiple challenges. And then I took that big, massive job that I was headhunted for, and I wasn't happy. And I woke up one morning and I quit. And that was scary. It was very scary because I don't have a big trust fund waiting for me behind the scenes. Right. I have bills to pay. And I became a consultant, and it's now 2 years later, and I've set up my consultancy firm. And so life happens. nothing goes as planned. But
Right.
I think that what's so important for all of us is to remember why we do what we do.
True.
And I think that's always kept me going over the years.
Right. So it is fantastic to speak to you, and I'm sure my viewers will from around the world will would love to hear about what you have to say. And I really appreciate for taking out time and giving me this interview. So thank you so much.
Julia has been brilliant. And, I know this is for all the young women out there. And I just want to say that go out there and dream big, and don't give up on that dream, and
Right.
keep that fire burning no matter how hard it is. It's always going to be hard. Nothing's simple, nothing's easy. Success never comes overnight, but keep that fire burning and keep that dream alive. I mean, I always laugh, because when I told the class I want to be the president of South Africa, they had a big laugh about it. And many of them meet me today and said, actually, you stand a chance. And I said, but now that's not what I want to do. But
What do I do?
nonetheless, keep your dreams alive. It really is. It's special and spectacular.
Yeah. So, for all my viewers, if you are watching this channel for the first time, we have wonderful women like Dr. Shakira on this platform on a regular basis. So, do subscribe to my channel. I'm so thankful to you, Dr. Shakira, for giving this interview to me.
It's been brilliant. Thank you so much, Julia.